Thank you so much for being here. You have attended today the Elevating Patient Experiences, Trends, and Strategies for Healthcare CX. We're here with Amplix and Genesis. I will be your facilitator today. My name is Amy Bahbahani. I'm a senior CX consultant here at Amplix, and I'm joined by two powerhouses. They're going to introduce themselves, and we're going to go through a series of questions, leave time available for you to ask some more questions. We do have our chat available, and we look forward to making this really engaging and giving you some real applicable advice. So with that, I'm going to have our senior solutions engineer consultant, Kate Doherty, introduce herself. Kate?
Thanks, Amy. Hi, everyone. Kate Doherty. I am a senior solutions engineer here at Amplix. I've been in the contact center space for 25 really long years. I spent about 10 years in banking, and then I had an opportunity to transition over into healthcare. I spent 10 years at Providence Health and Services as an enterprise voice engineer, supporting, at the time, 51 hospitals, 1,500 clinics. My office was in the hospital, so I was right next to patient care and the caregivers going throughout their day. So my journey really focused on their experiences. And I love to talk healthcare. So I'm excited to talk to these two ladies today, including Tara Mahoney.
Thanks, Kate. It's nice to see you and Amy again. Tara Mahoney. I am our Vice President of Healthcare here at Genesis. That includes payer, provider, life science organizations around the world. My start in healthcare was really around patient access and supporting health systems from a technology perspective around how to provide better access to care. Prior to that, I ran product and research and development for contact centers. I've run applications businesses for Nortel many, many years ago, as every good Canadian does at some point, do a stint with Nortel. And I'm just thrilled to be here and talk about, our largest customer base in North America, our second largest globally, our fastest growing. So I'm just really looking forward to sharing, across the community what we've learned.
Thank you so much, Kate and Tara. So let's get into it. We have some questions that we want to start the conversation rolling. So our first question, and Tara, I'm going to start with you, and then after that, we'll kick it over to Kate. But our first question for you today, Tara, is what trends are you seeing in the healthcare patient experience space?
It's so funny if you'd asked me 2 months ago or 3 months ago versus now. I think, even now, things are changing because we know there's going to be more interest in less money in the system and therefore more interest in making sure that patients are adhering to their care plans, getting supported by both their insurance organizations, where of course we're going to see, less Medicare, Medicaid policies being supported. So really, we're going to see a lot of pressure on margin. And yet we still have to meet these value-based care metrics that are so critical to our value-based contracts. And so I think, of course, we care about patient experience. I think, though, a lot of it is going to be around how do we ensure that we are guiding a patient along their journey, number one, to reduce the burden on the care team if they get more and more sick. Number two, to meet those value-based measures, whether it's HEDIS scores, HCAP scores, star ratings, because that is going to help our profitability and revenue for our organizations. And then we've got this interesting dichotomy of patients still wanting, that personal touch. We know that 80% of patients in the US still say they would prefer to talk to their care provider than interact in an automated way. There's a distrust around AI and technology, and yet the flip side is 95+% of healthcare leadership say that AI is absolutely critical to staying competitive, making sure that we get access to the care we need, because we cannot hire our way out of the current crisis. So I think we've got these interesting trends, a lot of pressure on margin, as if there wasn't enough pressure before with most health systems operating on absolutely razor thin margin, less money in the system, more pressure to meet those value-based contracts. And then we've got this huge opportunity with AI and automation and technology. We have to innovate, and yet patients really want to still feel supported. So we've got all these interesting things happening in the industry. I don't know, Kate, what you're seeing.
Yeah, I think there's lots of trends, right? Like you just illustrated. And I think the customers that I'm speaking with, the health systems that I'm speaking with are faced with all of those trends, right? And many of them, they don't know where to start, right? And what I'm telling my customers is that doing something is better than doing nothing, right? We've got disparate systems. We've got that rapidly changing tech. We've got these staffing challenges, and then we've got the demands of consumers, right? I know one of the things that I talk to my customers about that we're seeing as a trend, right, is that consumerism is a real thing. Um, I expect my provider to know more about me than retailers that I do business with, right? They know all of the intimate details of my life. My provider does. Yet when I call a retailer, they know all of my demographic information. They know about the product that I just purchased. They know who I am before I even get to them. And we're not seeing that so much in the healthcare space right now because we've got so many things to focus on, right? All of these systems with all kinds of information about our patients and their journey. And then everything is rapidly changing. And how do we keep up? And I think that's, one of the trends that we're seeing too, is that everything is changing so fast. It's incredibly difficult for providers, for health systems, and even for patients to keep up with everything as it's moving along so rapidly.
Those are different trends, right? You're seeing it from the front end, the providers and the flows. Tara, and your experience being in the hospital, and Kate, you're seeing it from as you actually support customers being a solutions engineer, but they're all kind of aligning as we want this personalization and we really need some automation to make it happen so that we can offer more personalization because AI gives us the ability to do that, right? To look at their trends. And so because you see these trends, where do you see, and if you don't mind, I'll start with you, Kate, first. Where do you see the biggest impact or improvement with these trends in the healthcare space?
Yeah, great question. And I think it really depends on the client and what is most important for them and what's most important in their journey in this moment. And I think that sometimes the smallest wins are wins that can make a difference, right? Like I just mentioned that sometimes we don't even know where to start. So let's tackle one problem. And so I'm thinking of a customer that we worked with few months ago. They made an acquisition that resulted in thousands of calls each month coming in from providers to verify patient information, right? Status, deductible information, and all of these calls were intermingled with their complex patient calls. And those routine calls of verifying insurance information, deductible information, that was taking away from the patients. And it was putting long wait times on them. It was putting more stress on the agents. So we put in a virtual assistant, right? A small win that was connected to their CRM. The providers could then get that information. They could validate insurance status. They could validate deductible information whenever they needed to, 24/7, which freed up the agents to talk to the patients and gave the providers what they needed, right? It was a small, quick win that helped out their contact center, helped out their providers, and helped their patients to maintain that connectivity for those more complex needs. We've got another customer, right? These are those small wins that we should just be doing. We've got another customer. After call is a thing in the contact center space, right? We've got to make sure that we're documenting what's happening on these encounters. We've got to make sure that we're being thorough and accurate with that documentation. Our customer put in a co-pilot agent assist solution, and that allowed them to reduce their after call work astonishingly from 4 minutes down to 30 seconds. That's
Huge savings.
An 80% reduction in after call work, right? 3.5 minutes on average. The agents were freed up to go on to the next encounter and it gave them time to be able to move through, right? These small changes are incredibly meaningful. So I think it really depends on the client and what they're focused on. And again, I just want us to get started, right? We don't have to do everything all at once. Let's just get started. Tara, what about you? You've probably seen some different experiences
Well, I
with
guess I
customers.
want to comment on the second one too, like the documentation, because I think the time savings is incredible, but we
Mhm.
also know there's an accuracy. You know, you
Yep.
can have a 20, 30-minute nurse triage call or, you know, oncology referral call, and it is hard to remember, you know, what happened in the last 20, 30 minutes. And so there's an accuracy level as well that we're starting to see around the documentation and allowing the staff member to like really focus on the conversation and not have to sort of document while they're speaking because they can trust that there's going to be something to, you know, help them and jog their memory. Okay, so listen, you guys know my bias. You know, everything starts and ends with journeys. So like I'm just gonna throw this up, you know, Amy, like where have we seen quick wins? I love what Kate's talking about around being practical. I couldn't agree more. Um, for me, it's around like what are the top workflows where there is a lot of many to many interactions. And so how can we break down those workflows to understand how we bring some of this customer experience improvements, whether it's operational or technology, to bring to bear in providers, if there's providers listening in, you know, obviously patient access, as we focus more and more on patient access, managing referrals, reducing leakage, up leveling up physician occupancy. This is one of our biggest areas of focus in the provider space, which is we are going to focus on both incoming and outbound outreach orders and referrals and bookings, and we are going to automate what we can. Kate gave a great example. Let's identify with and validate with whom we're speaking. Let's see if there's been any insurance changes, any demographic changes to that patient. If it's a cancel, if it's a reschedule, let's like grab that appointment and not really have to involve a patient access representative. And so in that space, some of the quick wins Kate's, you know, was talking about, containing interactions, open 24/7. We are seeing on average, Amy, and I've got some statistics later if we want to share, but we are seeing like a 90% containment
That's
um,
huge.
in when and where is my appointment, what was I supposed to do again, which is, believe it or not, still a significant volume. Yes, you could check my chart, but not everyone checks my chart.
Hmm.
We are seeing about a 20 to 25% reschedule success rate. Um, often, often we can't get the appropriate appointment type, so we do have to send it to a human today. We're seeing a 60% containment in level one billing inquiries. So we're starting to see, like, if you focus on some of these workflows and you have the right integrations into the back end, we see some great outcomes. The only other one, so that's sort of like identifying and validating with whom you're speaking, focus on the workflow, automate what can be automated, and get them to the right resource the first time. And access is our biggest area of focus. I do want to talk though, because I mean, your question about big trends is these value-based quality measures and outbound. Um, we all have work queues lists sitting there, whether it's a health risk assessment, work queue, whether it is a post-discharge work queue, whether it's a referral or order work queue. The other thing that I find really exciting is we know that even when you tell a patient, a nurse will call you at 1 o'clock tomorrow to discuss how you're doing at home, they don't pick up. We have way too many care team members manually outreaching, leaving voicemails, hoping the patient or member will call back. And that's the other big win we start to see by having, first of all, you need to be able to pull the work queue in an efficient way with the right APIs. And then you need to be able to pull the communication preference. You pray that it includes text and bi-directional text. So literally we outreach to Amy saying, we would like to complete your HRA. This is critical to ensuring as a new member that you're getting access to the care they need. Please text us when you're available and we will call you immediately. Amy texts back 1 minute later, 1 day later, whenever she's done working and doing a webinar with Kate and I, she texts back, now is a great time. She gets a phone call. We semi-automate that HRA. She says she has an underlying condition and we escalate. This whole bi-directional text escalating to voice, not having people play phone tag. We have organizations that have gone from less than 40 to over 80% completion on some of those work queues. Any of you who have value-based contracts out there, who are measuring star ratings, who are measuring HEDIS scores, and you are not getting to 100% of your customer base, this is really significant to you meeting your value-based contracts. And let's be honest, just making sure that members and patients adhere to their care plans. So that's another big win that I'm, super excited about, Amy.
So you're meeting the patient where they are. Like you said, I have someone who's left the hospital. I'm tired. I missed the call. My phone's all the way over there. But you text me and I ask, yeah, I'll feel better in a couple hours. Give me a call back. Maybe it schedules a call back. We're now not wasting the care nurse's time. We're not wasting my time. It's scheduled. It's efficient. And so you guys both touched on some use cases of workflows on being able to do the little ones. Kate, I think sometimes we hear these big processes, but there's little processes of directing calls well, making sure to go to the right places, or allowing people to just check benefits eligibility. Maybe they don't trust the portal. Maybe you don't have a portal yet and you're just calling in to see if Amy's covered, for her exam coming up. I just want a quick automated system to do that. And so we might be fearful of AI. It's really helpful and, for both the person and the patient. And so we look at our biggest impact when you hear that these are the biggest impacts. So what's the hurdles for getting folks? And folks is general. So we're talking the healthcare system, maybe the patients, maybe your nurses, the operations. They all hear these use cases and they say, I want it, but there's hurdles there. So Tara, let's start with you. Can you talk to me about, these are great use cases. What are some hurdles to getting these folks there to actually visualizing and making it real for them?
Well, change is hard, and we know
Yeah.
that's in nature. I think one issue is we have technologists who don't understand workflows, talking to people who understand workflows but don't understand technology. I really do. Like I keep thinking AI, we need a translator, right? Like this
To help
translator
us
that
understand how to train our AI. Yeah.
So I do feel that there is no patient access representative out there every day desperate to figure out how AI can make their life better. Well, there might be some in today's day and age, there might be, but that's not, and so if you want to talk to them about AI, an SVP of access, maybe not. If you want to talk to them about containment, how are you doing on referrals? How are you managing leakage? That changes a lot. So that's one hurdle. Kate mentioned it. I mean, the other hurdle is the systems are desperate. We can see, and this is, a huge challenge. We can see a lot of very compelling, interesting demos and videos, but if those, if that technology is not integrated into your systems of record, into Salesforce, into Epic, into Meditech, into TriZetto, you really have one hand clapping because the patient member context exists in the system of record. And so great that you can outreach, great that you can, ask patients questions and understand their intent, but you can't really fulfill that journey without that, that integration. And so, that would be my two things. If we have technologists on the call, I would say you better understand workflows, and you really need to sit down and map them out and then see where some of these key technologies can match. And I just quickly, I like to use this kind of model here, which is like, if you think of any workflow, how do you identify intent? Could you be proactive? Do you have insight into what someone's doing on a website? What could you ask to understand with whom you're speaking and why? How are you then routing? Would you change the way you manage your customer volume if you knew with whom they're speaking and why? Would you do less bouncing? Could you fully automate some of those intents? What data actions would you have to dip into to the systems of record? And then if it does go to a human, what's all the information that would be much easier to be at that person's fingertips, that care team member's fingertips, so they could address the interaction? And then lastly, do you even understand the journey, right? Like, do you even understand where patients are getting bottlenecked when you're actually fulfilling a patient intent? Are you really capturing the voice of the customer? And I don't mean a 10-question survey. I mean, like in real time, what are they actually saying? And do you understand? And can you do service recovery? Because Kate just said that there's some weird green stuff coming out of her wound and you are popping and recovering a sepsis. You're going through a sepsis protocol and making sure that she gets to a nurse if she needs to. So I think, that's sort of aiming, like as technologists, ask them where there's way too much human pain and intervention, and then going through these different phases and how might we apply.
I think your approach of what you're saying, Tara, with that slide is also, it's not a, hey, we have the solution, it's a silver bullet, plug this in. You're taking a very collaborative approach of, let's look at the processes. Let's make sure the technologists understand and the people using it, because it's not just a plug and play, because it's humans using it and there's humans interacting with it. And earlier in the webinar, you said, our consumers don't necessarily trust the automation. So maybe when we get our back end, agents trusting the technology, they then get the front end consumers trusting it because it's helping them to do a better job. So really making sure we break it down and just not plug something in, understand what the customer is saying, not just the call was fine, right? What did they
I
say
think,
during the
Amy,
call?
too, 3 or 4 years ago, the three of us would have been like, if you were into this, you would have been an early adopter. You wouldn't have had this community of people who've done it before. We get our payer and provider communities together regularly, providers every month, payers every quarter, and they are sharing their best practices, their experiences. It's insofar that Genesis is even packaging some of these workflows, through our integrations with EHR and our relationship with Epic Workshop. Like, we are pre-packaging some of these. So in some cases, you're going to be possibly on the bleeding edge because there's a new workflow you want to tackle. But a lot of these workflows, you will no longer be the first, and you can put your own flavor on it because you have your own way to manage your patient population. And there are differences between patient populations too.
Yes.
But I think, it's really exciting, like compared to a few years ago. I mean, there are communities now who are sharing best practices.
That is
I think one of
exciting.
the bigger hurdles too that healthcare faces, which is kind of an interesting hurdle in the grand scheme of things, is that the demographics of the healthcare population literally goes from one side to the other
Yeah.
side, right? We've got our aged parents and our grandparents who need access to care and they want to communicate and they expect to communicate one way. We've got this generation that is kind of where the three of us girls are at, where we expect to communicate one way. And then we've got our children, right, who want to connect now on their terms in their own way, right? So from a healthcare perspective, we've got to, Amy, you said meet the patient where they're at earlier, and we really have to be able to meet each one of our patients where they're at individually for their specific journey. I am of the channel of choice where if it's digital, I will interact with you and I will probably adhere to my care plan a little bit better. I will show up for my appointments. My husband, on the other hand, though, if you send him a text message, he's not going to see it, right? So he's probably not going to adhere to his care plan. He's not going to show up for his appointment. If you call him, though, he will absolutely be there, right? So I think that one of the hurdles that we have to also keep in mind is that our population is so different and the demands for communication channels and styles is incredibly vast. So we have to
Yes.
be able to meet each one of those populations where they are to make sure that we're serving them in the way that is best possible for them, which also helps our agents, right, to be able to work through each one of these potential, care needs. It's a hurdle that I don't think we talk about very often, is that we've got demographics that are widely spread throughout the population.
And having the analytics on our communication preferences and how we each respond to different channels, and knowing that Amy prefers this, Kate prefers that. You can reach Tara, through text is very helpful so we can adapt. And that's where our AI will help us, right?
Yeah.
You both have been driving us towards understanding some top use cases, our biggest impacts, our biggest hurdles. I'm wondering, I know when I worked in healthcare for 15 years, it was always very overwhelming. Where do I start? If I'm sitting in the audience today, I hear these are really amazing things. This elephant is so huge, I don't know where to start. And so I'd love to hear, Kate, from a solutions engineer perspective, how would a healthcare organization start with their CX technology overhaul?
Yeah. So I kind of touched on it a little bit before, but I think for me the answer is just get started, right? But more importantly, the message that I always try to get across to our customers is it doesn't have to be all at once, right? Oftentimes we don't recommend that you do everything at once, because as an organization, you've got lots of questions. How do we improve patient experience? How do we improve access to care? How do we better manage our staff? Maybe you don't even have the metrics to understand where gaps are in each of those areas, right? So continuous improvement is key, right? We've got to regularly assess patient outcomes, the workflows that Tara has touched on so many times, what our care delivery models look like, right? To make sure that they're effective and that they're compassionate. I challenge my customers to think creatively. Think creatively about your own experiences, your experience as a patient, your experiences as a family member of a patient, right? Maybe you had a loved one who has been in the hospital, has needed to receive care. What was their experience, right? And how does that feel in terms of your own organization? Let me just give you an example. I'm of an age, and it was time for my annual mammogram. I got a letter in the mail, an actual piece of paper came in the mail from my mammography center, and it became a piece of scratch paper. And I knew in the back of my mind, right, that I knew it was time. And I never got an SMS. I never got a phone call. I never heard from them after that piece of paper, right? So finally, I put it on my calendar and I called them. And when I called them, it was in the middle of the day. Like you ladies, and probably most people on this call, were in back-to-back meetings all day. I didn't have time to sit on hold. They didn't even offer me the ability to do a callback, right? So for me, that was not a great experience. Finally, 6 months after I was due for my mammogram, I eventually got in there. But that's one of those easy wins, right? Where as an organization, if you think about that experience in terms of your own journey, is that something that you enjoy doing? Probably not. So is that something that your patients enjoy doing? Probably not, right? So
Mhm.
when we think about experiences a little bit differently, sometimes that can guide us to things that we might want to bring in organizationally, and areas where we might want to focus on. If it's not okay for me as a consumer, as a patient, to have that experience with another organization, why is it okay for my organization to put that same or a similar experience on my patient, right? So again, my recommendation would be you don't have to do it all at once. Continuous improvement is something that we see often. It's something that we recommend, but let's just get started. Tara, thoughts?
Yeah, I mean, I think I just add, because alignment is a challenge, right? Alignment
Mhm.
across leadership, across IT operations. Um, I would look at the measures that you're not meeting your expectations on, or
Mhm.
that align with your CEO or CIO or COO's top challenges. So, that might be leakage, that might be star ratings on screenings, it might be customer experience on um, star ratings. You might have gone through a massive acquisition and you're worried about physician occupancy and overload. Like, I really feel if you can link those frustrating experiences that Kate was, sharing, that they have impact on your top or bottom line. And so I would look to some of those. If you really want to like get started, you need to have a strong business case. And it's much stronger if it aligns to your executive's key measures as well. So maybe that would be, Amy, the piece I would add.
Starting, I like what you said. It's both of them. Starting small, but make sure it connects to something, right? Let's not say we just need a chat bot because we need a bot. There's nothing wrong with bots, but does it connect to something? Will the bot allow you to, do you have to be open 24/7? Do you have to be responsive in a certain amount of time? Do you have measures that say you need to be able to produce, provider results as far as who's in their network within a certain amount of time? Look and make sure it connects to your measures before you just start out there going towards just grabbing at technology to do it. We are technologists, but we want to make sure that it fits, right? We're not here to just shove technology in your face because if it doesn't fit your measures, your goals, your patient profile, then it's not going to work. There's no adoption and it's a fail, right? We want to make sure it doesn't fail.
And maybe the other thing is, so you want to appease, or not even appease, that's the wrong word. You want to make sure you align to your measures. You also want to make sure, back to the workflow, but that you are articulating for your frontline staff how it make, because there's, listen, the care team can accelerate or decelerate a program. And so that's the other thing is, if you go to let's say a nurse triage group and say, hey, we want you to log into Genesis, they're like, that's interesting. I don't care. I work in Epic. Uh,
Mm-hmm.
but back to Kate's point earlier, do you love documenting calls?
Mm-hmm.
No, you don't. Like that's not
Ask
your
the
favorite
question
part of the
differently.
day. Then hey, this will help you provide a summary, or this will help you automatically create an encounter in Epic and you won't have to worry about it. Or you won't have to leave voicemails and chase things and write outcomes of those voicemails into your system. So I think really understanding the pain and what drives the frontline staff crazy um, can also help reduce some of the resistance to change, because you're telling them that how the change affects their lives, not just how it affects your star ratings.
I think,
Yeah.
Tara,
I
what you called out was, I apologize, Kate, was that you're addressing that behavior, saying what is frustrating you. And then you look mentally, I call it in your Rolodex, if we still remember those, of what can we use to solve that? You're not just saying, do you want automation because people panic? You're saying, what are some friction points that you're experiencing? Not saying, do you want to be in Genesis? Oh, I have some of these tools to bring to you. It's not just go look at these tools, right? You're asking the right questions about your pain points instead of just showing them solutions right away.
Yeah, and I think Tara hit on something that was kind of near and dear to my heart, was that the caregiver experience is equally as important as the patient experience, right? They are the ones that are providing that care. They are providing the access to care. They are the ones that we want to be. I want someone to be compassionate. I want someone to have empathy when I eventually do interact with them. And if they've got 5 different systems where they have to find my information, if it's incredibly complex for them to be able to handle whatever my need is, that's taking some of their ability to truly be in the moment and be empathetic with me. So when we're talking about putting in the technology, we need to make sure that we're meeting the needs of our patients and giving them access to care and helping them to adhere with their care plan and focus on that. But we also want to make sure that we're never getting in the way of our caregivers' ability to provide that
Yes.
care, right? I don't want to put in a technology, Amy, that's going to make it really easy for you to schedule your appointment, but it's going to make it really difficult for me as an agent when you do eventually have to talk to me. So we want to make sure that we've always got the caregiver's best interests in mind, in addition to providing an incredible patient experience or credible provider experience, right? Whoever our end customer is, we want to make sure that, of course, their needs are being met, but we've also got to make sure we're meeting the needs of our caregivers internally as well.
I have a quick to validate you before we have a question was circa 10 years ago, we had put in a speech recognition system when I worked at the hospital. We foolishly didn't train the back end, the providers, the front desk, the patient access on how to use it. So when patients called in and said, I don't know how to get a hold of you, what happened was your caregiver said, yeah, I hate it. And then it perpetuated the problem, right? Where the patient said, well, you hate it, I hate it, so let's just find a workaround. And so adoption really went down, the failure tunnel, because we didn't set it up for the caregivers, the MAs, the administrative staff, to understand how to use it, right? So that they could train the population on how to ask the right questions to get where they needed to go. We failed at that. And I appreciate failing at it, because then we understood that we weren't considerate, that we need the people using the equipment, using the technology, to know how, so they can help our consumers navigate it, right? I have a question for you, Tara, and then we'll toss to Kate. You were showing some slides earlier on some metrics, but I also, in addition, wanted to know if you had any about some of your top outcomes that you've seen.
Yeah.
Maybe, yes, you are already primed and ready. I'd love to see it, because you have
Yeah,
such
yeah,
great
great.
slides. It tells a good story. Yep.
There was no lead in there, right, Amy? I didn't ask you to ask me about this. So I talked a little bit about, we go across our community and ask for outcomes. I think some of the coolest stories I wanted to share. One is one of our large health insurance organizations, they turned on predictive routing. So this is literally trying to match the customer and their use case, their intent, who they are, their demographics, to the best possible agent available at that time. Not send everything to Kate because she's amazing and like, let's burn her out. But really, at that given point in time, who's the best person with whom to deal with? They saw immediately, that's the only change they made, a 17% reduction in
Wow.
handle time just by doing that match. Another one, Motive Care, they do a lot of medical transportation. So think dialysis, special need transportation. Um, they just really drove up members because it became so convenient through a digital channel, not even logging in, to a portal and having to find the information to schedule rides. They saw a 63% increase in members using digital channels and 150% increase in bookings. This is not your legacy IVR. And so we're seeing success rates of like 85% of patients being identified and validated and the intent understood. I'm not going to pick out all of these. I already talked about that improvement through bidirectional outreach, linked to work queues, seeing that 50 to 80%. By surfacing the right information in a timely fashion, one of the top 10 health systems in the US, they saw a 13% increase in appointments scheduled per week. Just think about what a 13% improvement in your physician occupancy would mean to your organization. This is not about how great your access representatives are, because they are, but this is also like, how do you get people in? So that's really an exciting example. The other one on here is really this real-time screening surfacing for patients at risk. A lot of us talk about, hey, we'll ingest all of your knowledge, which is probably a dog's breakfast right now, and then like we'll surface it at the perfect time for your staff members. And that's true, but there's a lot of dependencies there, and I'm not going to trivialize that. The baby step that Kate was talking about is, what's the knowledge that's most critical to surface that puts your value-based contracts at risk? Is it seniors not understanding how to get access to care? Is it making sure that your patients get to a nurse if they're presenting certain symptoms post-discharge? And that, one of the things Rochester Regional is doing is they are actually surfacing screenings to non-clinical resources to ensure that they're asking the right questions to determine whether a patient needs to talk to a clinical resource. And so that to me is a really exciting, use case to reduce readmissions and to make sure that patients are getting access to the care they need. I have some other examples here, Amy, but those are sort of like some high level.
Well, you said it again, the big one, the Rochester one, you said they surfaced information that connected to their ratings, right? Their value-based metrics, right? So they connected that. It wasn't just them
Yeah.
serving a bunch of information. It was very specific to what's important to us strategically with our measures as a company.
That's right. That's right.
Very important. Kate, I'd look like you had something to add to our outcomes section there.
Yeah, I was just going to say that all of these things, right? Again, we talk about not necessarily needing to do it all. There's Tara's got 4 different buckets here where there's wins in each one of these categories, whether it's AI routing and engagement or co-pilots and summarization. There's measurable outcomes demonstrated across each one of these 4 places where we don't have to do it all at once. We just pick something and let's get started. And there's wins in each one of these categories, which I think is, sort of shows the power of the technology that we've got today, is that we can create change and we can create impact in various spaces without needing to do it all at once.
Thank you, Kate. Ladies, I want to do a time check. I know we're at 42 minutes after and we have more questions, but I also know we could do this all day. And I see some questions posted in here. They appear to me as anonymous. So it says, "Hi, thank you so much for your background and story sharing. It sounds like you're talking a lot about automation and AI. How have you helped patients feel comfortable with these changes while still feeling empathy required in healthcare and ensuring that they get their access to healthcare teams that when needed?" That was a mouthful, ladies. I'm happy to repeat if you'd like.
No, okay, so I guess there's 2 responses I would have.
Mhm.
Number one, words, workflow, education does matter, right? Putting in something without explaining, even with a few sentences. I gave an example earlier. To say, please complete your HRA is not useful.
Not a call to
Um,
action.
you
Yeah.
know, we're gonna outreach you to ask you a few questions to make sure you get the access to the care that you need, and is different. Saying, please enter your date of birth and your last 4 digits of social and whatever, is going to raise suspicion. Explaining that, we want to get you to the resource who can best book your appointment, and therefore we need to understand a little bit more about you and your and the practice you need to see. Those things matter. Kate mentioned too before is providing choice. So believe it or not, we have some health systems who have incredible digital and automation adoption, but they give some of the workflows the option to kind of go through the old school DTMF button pushes or speak natural language because they're trying to meet some of the demographics that Kate was highlighting earlier. So there's a lot about like words matter, mapping to the workflow. You don't aim in healthcare anyway today to automate something end to end. Think of an oncology referral. You're not going to automate every part of an oncology referral. It's
Mm-hmm.
impossible.
Mm-hmm.
It's overwhelming. Things need to be sequenced. You need to understand more. There might be financial assistance, coming into play, and you're not going to do that over automation end to end. You might let Kate know that you're meeting with we're trying to find the comfort messages, right? We're trying to find the best oncologist, and they're just reviewing your labs now to determine if they need you to do anything more before you come in. You might say, your authorization for procedures have been approved. Now's a good time to outreach to us. So there are aspects. Please don't forget to not eat or drink before coming in tomorrow. Please take the red pill an hour before you come in. That kind of thing.
Mm-hmm.
So I think that's one piece. And then the second is I was at this great conference a couple of weeks ago in Boston at Bamberg Health, and universally, leadership across operations, clinical, and IT was like, we don't want to automate everything. We do want AI to prioritize with whom we need to speak and let us know why. This priority of who needs to get to the care team first. That
Mm-hmm.
oncology referral, yes. Tara rescheduling her annual, maybe not. And
Mm-hmm.
I think that's really like critical here is how do we use um, AI to still get you to the right care team member, but in a priority order because we just don't have enough staff. to handhold every interaction throughout a care journey. It's impossible. So I guess that would be my response to that question.
These are great
Yeah.
examples. Thank you. Kate.
I think, yeah, I think just to kind of expand on what Tara was saying, words matter, right? I worked with a healthcare organization early in the year, and they went on this journey to implement technology and implement new channels, and they recognize that they have demographics across the board, right? So if you're a new patient in this organization, you actually get a technology onboarding offer, right? So these are the ways that we can communicate with you. Do you want to talk to us by voice? Do you want to use our digital channels? Do you want to use our application? If you want to use our application, they actually walk you through setting up your password, getting in, making sure that you know how to cancel an appointment, schedule an appointment, whatever it needs, right? They do a technology onboarding, giving you the option as the patient to understand what your choices are and then feel comfortable in that choice. Also knowing that if something doesn't feel right and I need to talk to someone, I can talk to someone quickly in this way, right? And I thought that was brilliant, right? Like, why wouldn't we offer that to our patients, to our consumers, right? So they do that for new patients, and then I believe that they also do it at certain checkpoints, and I think they might just randomly offer it. Like, do you need to feel more comfortable with our technology? Here's how we can help you. So again, those words matter, and I think, Amy, in conjunction with what you said earlier about your experience with not training, right? We've got to train our individual people so that they understand why we're doing that, so that when they end up talking to our patients or providers, they're bought in and they can maybe help to encourage some of those behaviors and help our patients and providers utilize the technology to better serve us all. And I think, again, just sort of thinking sort of creatively and outside of the box, Tara mentioned, we don't have enough staff to do all of the things. Tara and I've worked together for a really, really long time. And one of the use cases that she presented many years ago, I won't say how many years ago, but many years ago when we first started working together, was this idea that staffing has been a problem for a really long time, believe it or not, right? And if you put yourself in the shoes of the patient, the workflow that Tara was talking about was about using automated outbound dialing campaigns. And you are a patient and you're getting prepared for your first chemo appointment. What's the chances that packing the things that you need, right? Your blanket, potentially your favorite water bottle, a book, chapstick. What are the chances that you forgot to pack those things? It's probably pretty high, right? But if you get a call from your organization reminding you tomorrow this is going to happen, make sure you have these things packed. Here's a list. If you want to talk to someone, press 1 and we'll get you out to an agent that you can talk to, right? That's a very empathetic use case, right? It's a very engaging use case, and it's using automation to keep our patient connected and to remind the patient that there's something that you do need to take, potentially you need to prepare for. And we recognize that it may not be top of mind because you've got so many other things going on, but this is our attempt to engage with you. And we're also giving you the ability to engage with us if you feel the need to, right? So thinking creatively, putting yourselves in the shoes of the patient and seeing the workflow through their eyes, and where we have opportunities to be empathetic and to engage with them, to help them on their journey, helps us too.
Who would have thought that 50 minutes would go by so fast? Actually, I was not surprised with the three of us. I know that we're going to be, let me round us off. And really, what did we walk away with here is you're listening to three individuals who've all been in the healthcare space. Collectively, I'd say we have 100+ years based off of our time. Hey, I said collectively. And but I think the goal would be to walk away is reach out. Right? This is not a process you need to undergo alone. We each come with different experience. We collaborate together. We can help you zero in. Maybe you want to start here and really want to do the comfort messages. Maybe you want to automate some follow-up calls. Maybe you want to better understand when patients are calling, what their demographic is, what they're asking for. There's just little use cases. We can certainly help you not make this an arduous process where you're hemorrhaging money and you're actually still taking care of your patients and your staff while you're leveraging some modern technology to help you do your job. I always want to have been in those shoes of, I was very excited about all the technology. I would attend the conferences that we've attended, walking away, but feeling maybe a little lost on I didn't know where to start. And I don't want any of our attendees today to feel excited but not know where to start. So you're welcome to reach out to any of us. We work closely together. You can hear that there's been times where we've tried something and failed, but we work together as a community because our goal is to just to help our patients out there. Kate and Tara, I'm so thankful to know you both and work with you and learn from your experiences. This has been really helpful to share your different perspectives on what you're doing from a technologist perspective and to help our community out there. Would you like to leave any comments before we close at our webinar today?
Thank you. Summarized great, brilliantly, Amy. But I'm grateful to our relationship, the two organizations working together, and of course, as you say, to the community who constantly challenges us to be better.
Yeah, absolutely. I mean, ditto to both of those sentiments. I think healthcare is near and dear to all of our hearts, which is why we're having this conversation. And I appreciate both of you and look forward to the next 100 years of our combined healthcare
Collectively.
experience, collective.
Thank you everyone so much for attending. We will send out our recordings and I know we'll post this shortly. And we thank you for your question and have a great rest of your day, everyone. Stay cool.